The good news is we're seeing that children's reactions to the vaccines are very similar to what we saw in adults. So fever, muscle aches, fatigue, or headaches. In fact, what we're seeing is children are having less severe reactions than adults, probably because the dose is lower. Now, importantly, in the trial, they didn't see any myocarditis or inflammation of the heart muscle occurring in this age group 5 through 11. But you have to keep in mind that it's a small data set. So if you have a child that has a reaction other than the usual, like chest pain, shortness of breath, palpitations, or feeling dizzy, it's important to get it checked out. If your child has fever, muscle aches, or fatigues, you really just wait it out. Most of them were mild to moderate in severity and only lasted about 24 to 48 hours. It's important not to give your child ibuprofen or Tylenol before they get their vaccine. A lot of people think that it prevents the reaction, but the CDC says there's mixed data. We're not sure if it actually affects the immune response. Now, of course, afterwards, if they have a fever, you can give them the appropriate age-based dose of ibuprofen or Tylenol if you need to, but if you have any questions, talk to your pediatrician. Children are going to need 2 doses of this messenger RNA vaccine, and they're spread apart just like with adults, but with 21 days, about 3 weeks apart. Now, you don't want to go too far outside that window or before that window, and they're really considered fully vaccinated 2 weeks after the second dose. So it takes about 5 weeks for the complete vaccination. There's some differences. The biggest difference with this vaccine is the dose of this vaccine. So it's the same type of vaccine, a messenger RNA vaccine, where your body is given the blueprint for that spike protein so that it learns how to make antibodies against it and fight it. But the adult-sized dose of this is 30 micrograms. And for this age group, 5 to 11, we're only doing 10 micrograms. So it's really important when you go to get your child the vaccine that they're using the pediatric dose vials and not the adult dose vials. And that's something you ought to double check. There's so many good reasons for kids to get the vaccine against COVID-19, but I can think of 3 really good ones. So one is for the kids themselves. Now, thankfully, kids are unlikely to get super sick from COVID-19, but we have seen about 150 kids die from COVID-19. We've also seen some have complications like multisystem inflammatory syndrome in children, and we know that with Delta, more kids can end up in the hospital. So it's a great way to protect them, get them back to camp and after school activities and getting back to in-person school and events without feeling as worried. The second reason is to protect the adults around them. So kids, even though they don't get as sick, they're still very efficient at spreading the infection. So when it comes to going over to grandma's or going over to a teacher's place or, having an after-school activity with the coaches, it's really important for kids to be vaccinated so that they can protect adults as well. And the third reason is really to help finish the fight COVID-19. We've been fighting this long enough, and because kids, which is such a large proportion of our population, continue to remain unvaccinated, it allows the virus to have a host to spread in, it allows the virus to mutate, maybe have a new variant, and then we may all have to start all over. If you look at the totality of scientific evidence, it's very compelling that this is very, very much in benefit of our kids, and the benefit far outweighs the risk. So I would say if you have any concerns or questions, talk to your pediatrician, but don't say no before you say yes.